Most people have made their decision by the time they actually call us and see us that that's what they want to do. They come in, we'll give them a little pre-op that helps them relax. We have them come in, Dr. Love sits and visits with them, goes over all their pre-health information and history. We get them started with the pre-op to relax them. We set them down. We take a little area in the back where we lift their hair up and we do just a slight little shave back there. And it doesn't matter if your hair is long or if it's really short. We'd like for you to have it a little bit longer in the back so it helps the patients cover up the surgical suture area that Dr. Love, when he takes the strip out, sutures that back together. So that hair is met hair to hair again, so you can't even see where the graft has been taken from. We have them come in at about 7 o'clock, and we expect, if we do 2,000 grafts on a patient, usually takes us till about 1 or 1:30. We're not working on them the whole time, but they come in, we get them, Dr. Love gets them good and numb in the back, just locally, with a local anesthesia. We let them sit for a little bit and let that get good and numb. We lay them down on their stomach. Dr. Love comes in, he harvests the donor site, and then we turn them back over and we let them sit for a bit, and then Miss Carrie and I are getting the suture cleaned up, ready to go. We take that strip over to an area where we dissect in the room. We never take the grafts from one room to the other. Everything is done in one area. So we dissect those grafts. The patient is relaxing. Usually we'll put a little something over their eyes to kind of darken the room, and we have, whether they have their music or our music, they usually take a little nap. Dr. Love will come in and anesthetize the front area and get that good numb locally. Once that's done, that's the worst of the whole surgery for them. That does sting, the local stings a little bit, but it's not anything that I've never had anyone get up and run and leave the room. So everyone just is really surprised how easy that goes. So they're working through that, they're relaxing. Miss Carrie and I are dissecting grafts. Once the patient is relaxed enough and numb enough and the grafts are almost all cut, I'll come over and we make the recipient site holes, which are very small, as well as the grafts are 2 to 3 to 4 hairs in the grafts. We like to put 2 hairs in the front. The 2 to 4 hair grafts we think are the very best, because one hair, if you are someone who is losing your hair, if you pulled one little hair up, you would notice that that hair just doesn't cover much. So if you get a graft that has 2 to 4 hairs in it, it looks very natural. We like for you to know that we charge $3 a graft, and that is not just for a 1 hair follicle. That is a graft that contains 2 to 4 hairs in each follicle.